Let's get started here. Let's get feeling better. This is today, I think this is week 11 of low back and lower extremity health. So we're gonna pop back here. So the first thing we're gonna actually be doing is going onto our backs, and we're gonna be addressing our ankles and a little bit of our hamstrings and hip flexors and all that stuff. And so all we're doing, let's actually go this way. All we're doing is laying on our backs. And you're going to be doing a straight leg raise. And now my leg gets, pretty high, almost 90 degrees, not quite 90 degrees. I did a lot of deadlifting and kettlebell swings yesterday, so my hamstrings are tight. But I'm coming up. I'm going to make one ankle circle clockwise and then counterclockwise and then down. And I'm only going to do 5 of these. And then I'm going to switch sides to the other side. So then I'm up, one ankle circle, other direction, and down. So we're doing 5 on each side. And down. You might feel that as you pull your toes back, you feel some restrictions in your calf, maybe your hamstring, that are limiting the amount that you can get your leg up. We're going to be doing a lot of stretching for the back of the leg, because it does influence the positioning and movement of your pelvis. I think I got one left before switching. It's really interesting to look up here and see some trees and palm trees and cafe lights and all that stuff versus we're seeing the clinic ceiling. All right, so I'm switching sides. One side, then the other. You see, I think I get this leg a little bit higher than my left side, and that's okay. We're built asymmetrically. We're gonna move asymmetrically, but sometimes being asymmetric can actually lead us to actually be at a higher risk of injury. It's actually been shown that if you have asymmetrical active straight leg raises, you might have an incidence of higher rates of low back pain with squatting and a bunch of other stuff. So we're going to stay in this position. We're going to do something very, very similar, except we're going to focus, instead of the ankles, focus more on the calf and on the hamstring. And to do this, we're going to hug behind your knee. You're going to pull your toes back, and you're going to kick straight. You're keeping your other leg locked out. So I'm squeezing my straight butt cheek and my quad. And I'm kicking up as straight as I can. I'm going to go 10 reps on each side. Once again, I just want to thank you guys for joining me. I know there's a lot going on. I question whether or not I should do this week with my wife being pregnant. And I want to be respectful to people taking their time to learn, have conversations with their family members about everything that's going on in this country. But I also want to provide people with a space that they can move and feel better, and feel confident in themselves. And that's why I'm here. That's why we're here. I got 3 left. 2 more. And I got 1 more. Okay, and then switching. Here we go. Other side, 10 reps. And so if you feel some numbness and tingling in your foot, that might be a sign that you have some sciatic nerve tightness. And that sciatic nerve, that big nerve, comes out of the backside of your hip. It's the combination of all 5 lumbar nerves. Runs down the back of your leg. But sometimes, if you're getting numbness and tingling with this extended position in your knee and in your ankle, and the flex position in your hip, you might actually be experiencing neural tightness, and you want to back away from that. You don't want to push through it. It's not necessarily going to get better the harder you stretch it. Actually might get a little bit more sensitive. So it's okay to say hello to it. It's not okay to punch it in the face. We got 3 more to go. 2, and then we are still staying in this position, and we are still doing a variation of straight leg raise. What you're going to be doing is a hip circle. So we're going to be exploring the range of motion in our hip, both from flexion to abduction, back to where we started, and then from abduction into flexion, and then down. So what do I mean by that? I mean, we're going to go up as straight as you can with your knee. You're going to go out to the side, and then swoop back down to where you start. Now what's important here is that you have a nice braced trunk. You don't want to just be kind of sloppily rolling all over the place. We want to stay nice and strong in your trunk. Doesn't mean flatten your back, it just means be braced, okay? So we don't want to flatten, we just want to be really strong through our trunk. Bring it up, out to the side, and swoop down to where you started. And we're going to go 5 in this direction, and then we're going to go 5 in the other direction, and then we'll do the other leg. I think I'm going to have to turn around for that other leg so I don't kick the wall. You can hear me have to strain as I bring my leg out because I'm trying to prevent that rotation from occurring and the extension in my lumbar spine. And 5, we're stretching out our adductors on the inside of our leg, and we're going to be using those when we do some Cossack squats later. So now we're going to go opposite direction, out to the side, and then up. So we stretch those adductors, and then we're using them through range of motion. Depending on how your hip is built, yours might look a lot different than mine. You might even be built different side to side, and you might have some significant differences in the amount of rotation that you can get in your hip. And we are using our hip flexors. We're going to do a lot of that because a lot of times a weak hip flexor is a tight hip flexor. So if we can strengthen it, great. And use it, we can actually get it to calm down and loosen up. And also, we're going to be giving ourselves an opportunity to stretch them in a little bit. All right, so we got 5 in the other direction. I got a stick in my leg. 1, 2. We're going with control, braced in your trunk. 3. I'm on a downhill slant, so that makes this a little bit harder. 4. 5, and it is okay if you get a snapping or a clicking in your hip. It is likely your tight hip flexors rolling over a bony prominence in your hip. The more strength, the more suppleness you get in your hip flexor from strengthening it and actually stretching it after that, the less clicking you'll probably it will result in. It doesn't mean that you're going to have pain. If it does hurt, I'd say then we need to maybe make some modifications. You can always reach out to my direct messages for those. Sometimes it takes a little bit more of an assessment, a little one-on-one look to see what's going on if that is causing you pain. 3. We got 2 more to go, and then what's next? Oh, cobras are next. We're going to start getting into our toes. We're going to start feeding some hip extension into our body. So this isn't any typical cobra. So I love cobras because you can make them kind of yours. There's a sweet spot for you, and that's fine. If you can only go up on your elbows, that's great. If you can go all the way up on your hands, awesome. But we're going to be doing these ones on your toes. So we're going to be working on big toe extension. We're going to be working our ankles. We're going to be working our quads, our glutes, and then we're going to be feeding extension into our spine. I think we're all in for a little treat here as my dog works her way into the shot. But we're going to go, and we're going to go for 8 cobras. And now, like I said, if you can only get to your forearms and your elbows, great. If you can make your way all the way up here, get a lot of extension in your spine, even better. But I want to actually go up on your toes so your knees are off the ground, getting into extension. We're basically anti-sitting. Lower yourself, push up, lock your legs out, and raise your chest even more. Into extension, lift your legs, get more extension in your spine, and then down. You have 5 more. 4 more. The only thing that could add more extension to this is if you were able to open up your arms and push your chest out a little bit more, stretching your pecs. I think I got 1 more left. And maybe for some of you, if you're trying this back extension might be a little sore. But like I said at the beginning, work with what fits you. If that was uncomfortable, just stay down. Maybe you work on your plank, maybe you work on a hip flexor stretch, your breathing. Anything you know that agrees with your body is going to be better off than something that is really, really uncomfortable that you're not going to want to do again. So we've worked on our ankle mobility, we've worked on our toe mobility, we're gonna put it together and have some neural drive come into our trunk by doing an ankle plank. So we're gonna be doing a regular on our forearm plank, but we're gonna be doing some heel raises with our ankles, allowing us to get some more great toe mobility and more ankle mobility as well, which will come back to help us with our prying squats later, and a bunch of other stuff that we got planned, maybe some of the split squats with the toe and the ankle that are coming up in a little bit. So we're just doing 30 seconds of planking. This is gonna be going at your pace. So what you're gonna do is you're gonna be up on your toes, so I'm already getting big toe mobility established. I'm down on my forearms, I'm squeezing my butt and my belly to get really tight. I'm putting a lot of the neural drive from my motor cortex into that area of my body. But then I'm going up and I'm going down. And when I go down, I wanna make sure I'm not piking my butt up. Okay, I wanna stay down in a straight line between my shoulders and my hips. I'm just going up and down. We're going 30 seconds. If my watch worked, I could tell you when 30 seconds ends. I think we're about halfway there. And so if you've been suffering from chronically tight ankles, this might be a great way that you haven't thought of to help loosen them up. Then you can follow it up after this with a little bit of calf stretching. And that might help you free up a little bit more range of motion if you're having difficulty squatting or some pain in your knees with running or jumping. So we're gonna start getting into a couple exercises that all work within the half kneeling position. So this is one knee forward, one knee down on the ground. And as we do this, I want that back big toe to be tucked under, okay? I don't want you here. I want to work on the mobility of the big toe because of how important it is for running, jumping, cutting, all the squatting that we're gonna be doing, the lunging, that kind of thing. We need good first toe or big toe mobility to do all those efficiently and without changing our mechanics in our knee and our hip. But what we're doing in this position is actually a tricep lat and a quadratus lumborum stretch, or a QL stretch. That's the muscle that sits between our belt line and our rib cage. And a lot of times, if we've been golfing or doing a lot of rotational sports or even sitting for a long time, that guy will tighten up. So what you're gonna do is, if my right knee is down, my right arm's going over my head, it's just kind of chilling. I'm gonna take my left hand over the top as well. I'm going to lean away, so I'm leaning to the left, and I'm rotating to the left as well. So I'm putting all this tension into my tricep, into my lat, but then I'm also stretching that quadratus lumborum in my low back. Now I can't see my watch, so I have no idea when it's gonna be 1 minute, so I'll just, guesstimate like I usually do. I'm watching my dog kind of walk around a little bit. Very curious with the whole setup in the backyard. Bulldogs are notorious for being freaked out when you change inanimate objects on them. So if you get new furniture, if you move the furniture, they kind of freak out. And our bulldog is kind of saying, what is going on? Okay, and this is going to be very similar to the other quadratus stretch, the lat stretch that we're going to do a little bit later with a lateral child's pose. So I'm going to switch my feet. Remember, big toe goes down. Let's see if I can do this from this side. Big toe goes down and back. Left arm's coming up because my left knee is down. Squeezing my butt to get a little bit of a hip flexor stretch. Leaning away from the left and turning to the right. Just hanging out here for 1 minute. I feel a big stretch on this side. Just gently breathing. If you want stretching to be something that you want to do again, it should never really be painful. Sure, I say, man, that felt so good. I want to do it again in 30 minutes. I want to break up my sitting with that. The goal is to change the way you fit movement into your life. If you're experiencing pain or discomfort, a lot of times it comes down to changing your lifestyle, sitting for shorter periods of time, maybe working more movement into your day, sleeping a little bit better, changing the way you stretch, all those types of things. I posted on that one this morning. It was a brief post, but I think it was worth saying. All right, this one's a little new to me. Maybe it's new to you, but we're gonna be, once again, stretching out that quadratus. We're gonna be working on your thoracic spine mobility, which is crucial for lumbar spine health Because if you don't move well in your thoracic spine, your lumbar spine is going to have increased stress go through it. Once again, back toes are down and back. Okay, so I'm not pointing my toes, I have them tucked under. I'm going to put hands behind my head with my elbows spread wide. Now my left knee is forward. Now I'm going to try to dip my left elbow to touch it. I'm then going to come up back to where I started and then turn to the left. And if that for some reason is uncomfortable, what you can do is you can just put your hand across and pry yourself open towards your knee and do 10 reps. But we're going to be doing 8 of these windmills, windmill right there, to thoracic rotation. So there's 2. We're working our obliques, we're working on our balance, we're opening up that back side of our back, that quadratus, your lat, maybe even a little of your tricep. You're just going with control. If you can't quite get there, you're going to do that variation I just showed you at the start. You got 3 more to go, then they're switching sides. 2, and 3. We're going to do a switch, so make sure you tuck those toes in back. So right foot is forward, windmilling down to touch my right elbow down, coming back to the start, turning to the right. Maybe you get a little bit of a stretch in your adductor and your hamstrings as you go down into the windmill. That's expected. You want to make sure that you're controlling where your knee is in space, trying not to let it cave in if you can. It's going to help you with your balance. You got 4 more to go. Two more. And last one. Oh man, feels good. That was a little strenuous. Good to. All right, so now we're on to the exercise that you need the wall for. We're going to be working a little bit on your hip flexor mobility, but also your hamstring mobility and your trunk stability. We're putting this all together. You're going to be in a half kneeling position. Once again, toes and back tucked under. Because why not, right? If you have an opportunity to work on that great toe mobility, take it. From here, I'm using the wall for balance, just leaning into it a tiny bit, because I don't want this to be a balance exercise. I actually don't want you to focus on that. If you have to and you need 2 broomsticks or a foam roller or something to hold on to, great, grab it. But meet us back down here in half kneeling. We're only doing 5 of these on each side though. So what you're going to do is you're going to create a lot of tension in your trunk. It's just like at the start with your straight leg raises. You're creating a lot of stability in your trunk so your periphery can do a lot of movement. What you're going to be doing is you're maintaining a tall trunk. I'm squeezing my back butt cheek and I'm kicking as straight as I can and then bringing it back down. So you say, oh man, that's pretty good. It's a little hard. Maybe you can only do this and slide your foot out. If that's the case, I want you to grab underneath your thigh if you can. Stay tall, squeeze that butt cheek, lots of trunk tension. Kick straight. 2. We got 3 more to go. 1, you're pulling your toes back at the end. 2, we have 1 more to go. And 3. So I'm going to switch sides. We can try this one without my hand. 1. We're using our hip flexors again. We use them a lot at the beginning. We're kind of waking them up again, kind of driving a lot of nervous system activation to that area. Activation might be the wrong word I'm looking for, but we're using our hip flexors a lot, and then we're going to stretch them out here in a second while we're down in half kneeling. I think that's 3 or 4. 4. 1 more. Like I said, if you need to use that hand to help support, go for it. If you can hear the neighbor's kids here. All right, so we're going to be doing a hip flexor stretch. Open up the front of our hip. We've been sitting a lot, so we get adaptive shortening in our hip flexors. You're going to be leaning over. You're going to tuck your hips underneath. You're gonna get tall through your chest. So I'm squeezing my back butt cheek. I'm pushing my hips forward. When I do this, I'm not leaning my chest back. That's gonna create a little bit more compression in my lumbar spine. Might irritate things if it's already bothering me. And if you can, if you're not getting much of a stretch here, you go forward, grab your ankle, but just be really upright in your trunk. We're gonna be here for 1 minute on each side. Nothing like kneeling on a bunch of pebbles underneath a yoga mat. Feels really good. And then we're going to be going to the other side here in about 30 seconds. And if this is a struggle, if you need to lean back, if you're really losing your balance, just put that foot down. Get that hip flexor stretch. Maybe don't focus so much on the quad stretch you get with this one. Main goal is to just feel good while you do it, feel better after. And after this, we have 3 variations of squatting and 1 stretch, and we're done. We've worked a ton of stuff already today. We're gonna really drive some strength, some control into those hips, ankles, knees, and toes with the next little series of squatting. We'll switch sides. Just grabbing this one, okay. So I'm down, I tuck my butt, I come up, I'm squeezing my butt still. I'm feeling that hip flexor stretch in the front, grabbing. We're just here. 60 seconds. I can actually count for you on this one instead of guessing. I'll still probably forget to count. I don't know. We're just hanging out. A little hard stuff will come with the split squats, Cossack squats, and prying squats. All things that are going to help us open up our hips a lot more, while also incorporating a little bit of thoracic mobility with the prying squat. The Cossack squat is going to get more of our adductors or inner thigh, but also a lot of hamstring as well. We got 25 seconds left. Work on my balance here. It's kind of nice being in my backyard. Yeah, no, we got a lot of fresh air going. This is good. All right, we got 5 seconds left. Once again, everybody, thank you for joining. You're here because you're trying to feel a little bit better, do something for your health. All these virtual clinics, always free to access. Send them to your family. Hopefully they can, or your friends, hopefully they can help them feel better as well. All right, so we were just in that half kneeling position for a couple exercises. We're gonna get out of this a little bit. You're gonna be doing some split squats, which is exactly what I just did. We're just basically in that same position, except raising up. It's a split squat because it's half of a squat. So if I come here and I do a squat, I take my leg away, I'm basically going down a little bit further into my split squat. So you're gonna go down, you're gonna tuck your toes underneath, you're gonna have 90 degrees at your knee, 90 degrees between your thighs, 90 degrees at your other knee. From here, create a lot of tension, squeeze your butt, straighten your front leg, and you're coming up. And we're gonna do 8 of these on each side. You're gonna drop your knee straight down, and 2, and 3, and if you want to grab some dumbbells or a kettlebell or a barbell, be my guest if you want to load these up. When you load up exercises like this after stretching, you're going to kind of really imprint that movement pattern into your movement repertoire. You're actually going to be gaining more flexibility than if you just stretched. So a good way to gain flexibility is actually strength training after you've stretched, so you can use that newfound range of motion and imprint it on that motor cortex. I think I got 1 more left. Okay, we're gonna switch around. So we're down to start, all set up, 90 degrees everywhere, and we're just up. And if you need to adjust, if you're a little short when you do this and you're getting kind of crunched on yourself, just move that knee back or move your front foot forward a little bit, and that'll kind of clear you out so your trunk is upright. I did a ton of step ups and front squats before this. So my legs are toast. I think I got 3 left. 1, 2, and 3. All right, so we're going into a prying squat. Now, a couple weeks ago, I taught my brother how to do these. So you guys get to learn today. So you're gonna go feet about shoulder width apart. I like if your toes are forward, but they can be turned out a little bit. But I don't want you out here I think it's called a plie. I don't want the toes way out in first position. A little bit of rotation is okay. Straight is preferred. You're gonna drop down into a squat where you can get your elbows in between your knees. You're then gonna drop one hand down, open up towards the sky, other hand goes down, open up towards the sky, and once again, we're addressing thoracic mobility and adductor mobility, inner thigh mobility. We're using all that ankle range of motion that we were getting earlier. We're working on earlier with our planks, our cobras. We're making 8 of these. Really opening up, looking up towards the sky, really working in thoracic mobility into our squat, because it is important. If you have poor thoracic mobility, when you squat, you're more likely to fold forward and not be able to maintain a more upright position. You might lose your balance. You might feel like you're going to fall forward. We got 4 more to go. Once again, if you guys have any questions, feel free to ask them. I'll try to get it to them at the end. If I can't come up with the answer right at the end, I'll reach out to you, message you. I think I got 2 left. And then we're doing some Cossack squats for our adductors, glutes, frontal plane stability. So frontal plane being moving sideways, which we do most of our athletic movements in besides running. Running is sagittal plane or coronal plane, coming right at you. I think I got 1 more. Last one. Open up nice and big. Big inhale, big exhale. Same thing on this side. Okay, so we're going to take this stance wider than our shoulders. We're only going to be making 5 Cossack squats to each side. We're going to be loading up the lateral structures of our hip, keeping our chest upright, so we're controlling what's going on in our midsection. We're controlling what's going on the outside of our hip. Loading up, other foot comes up, getting that adductor, hamstring stretch, chest is up, to the middle, and then down on the other side. And that's 1. We have 4 more to go. Remember, everybody's a little different. If you don't get down as low as I do, that's okay. One day you will. You're just gonna keep working at it. A lot more mobility in your adductors and in your hips. Your thoracic spine will help. Strengthen your glutes. Toes come up on that down side, on the non-working side. I think I got 1 more left after this. Going as low as you can. Maybe you want to hold on to a chair or a countertop while you do these for balance. Totally fine. It's going to help you access a little bit more range of motion, a little bit more control, and that's all we're going for. Whew. Okay, so we've made it through the hardest little section, the 3 variations of squats. Split squats, the prying squats, and the Cossack squats. Now we're just going to finish with a little stretch, once again, for our quadratus lumborum, our lat, and our tricep. These guys that can maybe restrict our rotation, our side bend, even our flexion, which is important. We can't demonize it. As long as we're prepared to flex, as we talked about last week, it's totally fine. It's when we do too much, too soon, too often that we start to get into trouble. So what we're going to do is we're going to go into a child's pose and then go over to one side to stretch out that long side. So my arms are out, over to one side, and just stretching out. We're going to be here about a minute. Let's see if I can look at my watch here. Head is down, just breathing, catching your breath after all those squats. And if you feel like you're loosening up a little bit, maybe lean away, get a little bit more stretch. Just breathing, taking it easy. Already into the evening, depending where you are. Where I am, what time is it, like 5:30, maybe it's 8:30 on the East Coast, anywhere in between. Just trying to wind down a little bit for the rest of your evening. Deep breathing is going to allow your central nervous system to relax a little bit. You'll be able to access a little bit more range of motion in your muscles if you can do that. Just to relax. Then you'll have made it through another day, another week. Virtual clinic with low back pain. Even hip and knee pain, ankle pain, toe pain, all that stuff was addressed today. We've gone to the other side now. Then on Thursday, pregnancy depending, we'll be going for upper back, neck, and upper body. Gonna work it all in this week. And I feel a nice little stretch in my left lat, left tricep. Nice deep breaths. It's been terribly windy here today. I'm sorry if the microphone picked up a lot of that today. But I'm here just in case I need to jump in the car, drive to the hospital. 10 seconds left and then we're all done. I'll take a look at the comments and questions, see what I can answer, maybe help a couple people out before I jump off.